So go ahead, bring your feet forward. So this test here in the North American Institute, we call it the Portland test. I call it also a load transfer test, and there's different iterations of this test. The basics of it is we're just seeing if somebody in stance phase of gait can actually transfer load through their sacroiliac joint. So the way they do it is you have the patient step forward, in this case with the left leg, and they're in left stance. And you want them stepping forward the distance that they would normally step in a regular gait pattern. Then, somewhere around the lumbosacral junction or a little bit below, you push along the angle of the sacrum or the SI joint. When you do that, even a light push, you can check to see if the patient's buckling or not. If their core stability is good, they are pretty solid. If not, you might see a buckle, and some people actually lose balance. You can also check to see how they move on the opposite side. So this one just naturally is buckling a little bit on the left side. So then you're like, okay, that's when heel strike happens. Let's switch the feet, and we'll check again. So let's see how stable he would be for push-off. And he's a lot more stable for push-off here, but right here he's a little bit more. And you're going to have a little bit of unsteadiness through the SI joint, but this is a good way to show the patient that, hey, when you're heel striking, you might be buckling a little bit. So that's where we want to uptrain the core and have them work on uptraining their core. And we have an exercise we'll show you a little bit later on how to do that.